I'm short enough.
So when I asked for a straw, I'd like you to get
Oh,
one.
get off my arm!
Really?
Last time I forgot to turn on the volume, so this time,
Okay.
let's see.
What we're gonna have is right near the ear, we're going to have the salivary gland known as the parotid. It's right there. Okay? Parotid gland. Near ear. This is going to be our submandibular gland. And our sublingual is going to be right there. It's a tiny one. So, parotid, submandibular, sublingual. Now, the hyoid bone is right there. Can you hear it? Okay. That makes this the thyroid cartilage. Below the thyroid is going to be the cricoid right there. Okay, now you can see the arytenoid right there.
What's it called?
Arytenoid. It's a cartilage that's on the inside. Can you see the white area right there?
Yes.
Okay, that's the arytenoid. Then this would be cricoid. Here's your trachea. Remember that the esophagus is going to start out behind, but it goes to the left side. This is the esophagus. It's a big collapsible tube. Okay? So right here is the esophagus. Now, this is the thyroid gland. Over here is the other thyroid gland, right there. Okay? It's a little bit harder to see, but once you've seen one, you've seen them all. Okay? Now, the trachea is going to split and go down, and unfortunately what they did was they took off all the, this is called the root of the lung. Can you see where the tracheal passageway or the bronchus was?
Yes.
Okay. And then pulmonary arteries and pulmonary veins. This happens to be the aorta right here. There's your esophagus.
It's naturally that red.
No, they've injected it with some dye. Here is your diaphragm. This is the parietal pleurocyte. This is parietal pleura. This is parietal pleura. Visceral pleura would be right on the surface of the lung. Now, my trusty assistant is going to get me a fresh straw.
Where is this straw?
Right behind me. Nope, over.
This is a nice juicy one. Ours is all
You
dried
don't
up.
want the dirty one.
Not so much.
Juice is better? Okay.
Oh, that's awesome.
Okay?
Yeah, we gotta do that on our table. You don't follow it.
I'm trying to get both sets inflated. But that would have been a primary. leading to a secondary, then to a tertiary, and then we would go to all the different orders. There are 23 orders. Okay. Now, once we go inferior, obviously this is going to be our heart. Our heart is suspended in the middle mediastinum. This is the parietal pericardium. This is visceral pericardium. Just like this would be visceral pleura. Okay? Whatever the name is dependent upon the organ that it's on. Now, these would be the lobes of the lung in their normal position. These, as I said, have been taken out. They would have been located right about there. Okay? No longer there. Once we go inferior to the diaphragm, we're going to locate our liver, many lobes of liver, including there, and there's even a little guy right there. Okay? This one is the gallbladder.
Oh, this might be the green bile.
Yep. Now, once I go below,
Okay.
now you can see cystic duct right there, because it's coming from the gallbladder. Hepatic ducts coming from the liver, leading to the common bile, which goes into the first part of the small intestine, the duodenum. Okay, see where it goes in? Now, here is your pancreas. The pancreas is going to be shaped either like a 7 or an L. You're going to see it as an L, we're going to see it as a 7. So, all the way from here to here to here is all pancreas. Duodenum is here. As long as I've got duodenum, or pancreas, I've got duodenum. As soon as I run out of it, so you can see my glove there, now I've got jejunum. Jejunum, ileum.
Now, how do you know when it's
Just split it halfway. Anything after duodenum, split halfway. I know that's ileum because this is my cecum. It's shaped like a C, so it's the cecum. In between the two is the ileocecal valve. See the lymph node? Or lymph nodes? Then here is the rest of your colon. Don't cut that. This is mesocolon. See that clear membrane? This is mesentery proper.
Oh, it looks like a web.
Yeah, it does. It's holding on to the small intestines, so they all stay tightly coiled. Now,
Gives blood supply too, right, to the
yeah,
intestine?
exactly. This is the greater omentum.
That would cover all of the visceral organs?
Yep, it sure does. See it? And I don't have both halves of it. Yep, this is the fat skin. That would actually split apart.
So that's it.
And it would actually cover all of that.
And not the liver though, just the intestines.
Just the intestines. Then, if I want the lesser omentum, it's right here. See that little membrane right there below the liver? In the lesser curvature of the stomach?
Yeah.
That's the lesser omentum. Here is your greater omentum. Greater curvature of the stomach, greater omentum. Here is the spleen.
Oh, it's big.
See your own cat. And here is the kidney. It was a girl.
Ovary?
There's her ovary. Here is her fallopian tube. Here's her uterine horn. Here's her bladder. This is the body of her uterus. And then kidney. Here's the adrenal gland. Here is the adrenal lumbar vein. See it? If it's running right over the surface, that's the adrenal gland. So adrenal lumbar vein runs over the surface of the adrenal gland. Okay? Where's the other kidney?
Where's that adrenal gland again?
The other kidney is there, and the other adrenal gland is hidden by my liver. See it right there? Right there. Can you see it?
Just the adrenal glands?
That's the other adrenal gland. Here, right there.
Oh, yeah.
Then here's her other ovary there, fallopian tube there. Now, while you guys are here, I want to show you the round ligament and the broad ligament. Let's see if I can get it on that side. The round ligament holds the uterine horns to the front wall. That's this guy.
That's the round ligament?
Yep. This is the broad ligament, that whole piece of membrane that holds her uterine horns to the back wall. That's so she can have multiple kittens by multiple dads.
Really? Frisky kitty.
She is frisky. So what will happen is she can mate multiple times.
To ensure, yeah.
Well, and she'll only mate when she's in estrus, when she's in heat. If she's not in heat, male kitty is not coming anywhere near her.
So she'll have the babies at the same time?
Yep.